I never have talked about this so openly, but today I wanted to make this video. My name is Heather, and this is the true story of my pregnancy and how it ended in a miscarriage that was nearly fatal to me. I want to share why I believe this happened. I want to go through everything that happened. I want to talk about why I had a missed miscarriage, what I believe I did wrong so it doesn't happen to anyone else. Have you ever had a dream that felt so real you believed it? Well, in November, this happened to me. In my dream, I took a pregnancy test, but everyone around me would not let me see the results. When I was finally able to flip the pregnancy test over, the results are positive. I'm pregnant. I wake up from this dream and I immediately want to take a pregnancy test just for kicks. I took the real pregnancy test, and to my surprise, it's positive. I'm pregnant. I honestly cannot believe it. Before we get started, I want to tell you about today's sponsor, and that is Dreame. Dreame is an exciting global reading platform. Each of us can relate to going through tough times. When you go through tough times, you can suffer with anxiety, depression, and emotional turmoil. One thing I took from therapy I received years ago was having healthy coping mechanisms is very important to healing. Coping mechanisms can be anything from going to a walk to reading a book, which brings me to Dreame. Dreame is launching a campaign. #Dreame Feed Your Emotions to care about women's health. Whenever I'm feeling any unwanted emotions, one way I cope is to open the Dreame app and read a book. Good stories in Dreame can heal your emotions. In Dreame, there will always be a story to heal your heart. Features of the Dreame app are numerous sub-genres, including romance, werewolves, marriage, pregnancy, and suspense, among many others. There are daily updates to free stories. You can also connect with a large community of book enthusiasts through reader groups. You can read for free and earn rewards. If you are an aspiring author, which I believe we all have an important story to tell, you can publish your stories to Dreame and receive exposure and earn money. I highly recommend the list of healing books in my link below. Now let's talk about my pregnancy, how it ended in a miscarriage, and what I did wrong. I honestly cannot believe it. I'm pregnant. I take another 2 pregnancy tests just to make sure I was seeing the right results, because sometimes you can get an indent line or an evaporation line on pregnancy tests, which means it's a false positive and you're not actually pregnant. But to my surprise, all 3 pregnancy tests, real pregnancy tests, they're positive. I am pregnant. I had no clue I could be pregnant. Me and my husband have been trying to conceive for 2 years. I knew it was possible, but I had no hopeful pregnancy symptoms all month long. I'm shocked. I run outside to my car so I can call my OBGYN because it's an emergency. I need progesterone. Progesterone is the pregnancy hormone that your body naturally makes to sustain a pregnancy. But some of us don't make enough progesterone on our own, which can result in miscarriages. See, I've had 3 other miscarriages, and I know I need that prescription of progesterone to help sustain this pregnancy. I call my OBGYN office panicking, begging them, telling them that I'm pregnant and I need progesterone. They tell me I need to email my doctor through the website and that he would see it a lot faster that way and I would be able to get the prescription sooner. I'm panicking because I have not logged on to that website in quite a while. I couldn't remember my password. I couldn't remember my username. Luckily, I'm able to figure out my login information and I'm able to email my OBGYN. That is all I can do for now until I hear back from him. Today, I also decide to go to the grocery store and pick up some groceries that will help me increase my progesterone naturally. I got prenatal vitamins. There are foods you can eat to boost your progesterone, and these are the ones I get. That's all I can do is my best. The next day, I wake up and I get the most relieving email possible. My doctor has prescribed me progesterone and it's ready. It's at the pharmacy. My husband goes to the pharmacy first and he picks it up for me, and I meet him there and he gives me the progesterone. I take my first dose. This is truly a great day. I feel everything is right in the world. I take another pregnancy test. I'm not sure if it was this day or the next day, but it is faint. I'm freaking out and I feel in my heart I'm having a miscarriage. All I can do now is pray and leave it up to God. I take a pregnancy test later in the day and it is more positive. So I get hope. Maybe this baby is here to stay. I'm claiming it. This is my baby and he or she is here to stay. I take another pregnancy test the very next day. It's even more positive. The line is getting darker. Every day I take a pregnancy test and it is getting darker and darker. I'm pregnant. Pretty soon after this, I set my appointment for an ultrasound. Christmas Eve, I'll be 8 weeks pregnant. The day has arrived. We are parked at the hospital right now. I have an appointment to get an ultrasound. This is going to be making sure the baby is okay. Just making sure the baby's where it needs to be and everything, and measuring. And we also have this number 3 balloon. We're gonna be taking pictures after this. It feels odd to me to get another ultrasound. I'm vlogging and I told the camera oddly, I will be more surprised if there's a baby than if there's not. I don't really know why I say this, but I think it's because I've had 3 other miscarriages and so many negative pregnancy tests each month when we're trying to conceive. So I'm just used to there not being a baby. We go inside the hospital, check in, and we're waiting to get the ultrasound. They call me back, and as we're headed to the ultrasound room, I'm thinking, wow, this is it. This is probably gonna be my very last 8-week ultrasound appointment. This is it. Maybe my last baby, but this is my baby I'm about to see. Everything is perfect. My mom is here, my husband, my son, and my daughter. I could not wait for my kids to see their new sibling. I'm nervous and excited. We go in the room and I sit down. The ultrasound tech tells me to pull up my shirt and pull my pants down to my hips. She puts the gel on my stomach and places the transducer on my stomach. She moves around and looks at everything, but she really doesn't say much. Nobody does. Everybody's looking at the ultrasound but me, because I can't really see it from where I'm at. I asked the ultrasound tech, is there a baby? Kind of oddly. She really doesn't say much. I could definitely tell something wasn't right. She says I might be too early to see the baby and that I need to do a vaginal ultrasound to see more clearly. I felt it was pretty necessary to get a vaginal ultrasound just based on how she was acting and what she said. My mom and my 2 kids, they leave the room and it's just me, my husband, and the ultrasound tech as she is doing the transvaginal ultrasound. She does the ultrasound, it seems like, for about 10 minutes and she doesn't really say nothing at all. I'm pretty much giving up hope at this point because I feel like if it was positive news, she would be saying something. After the ultrasound, she tells me it's not good. She says she can't really tell me much because she's not the doctor, but baby is way too small. In fact, it was really hard for her to find the baby, but my gestational sac was measuring 8 weeks. Baby was not 8 weeks old. Baby didn't have a heartbeat. I really don't understand everything. The ultrasound tech told me that my doctor would be calling me soon this day, so we leave the hospital. I tell my mom it's not looking good. I'm probably gonna miscarry again. We put my son and daughter in their car seats in my car. My mom rushes off to go ride horses or to go feed her horses. My husband rushes off to go back to work. So I'm driving home alone with my kids, feeling totally crushed. On my way home, an OBGYN from my doctor's office, not mine, but a different one there, had called me. And she tells me, I'm sorry, but you're gonna miscarry at any moment. I ask her, maybe, isn't there a chance? Maybe baby is just small and will catch up? She says no. I don't even know how to deal with this. It's Christmas Eve. I thought I was going to be announcing my pregnancy on Christmas Day, but instead I'm hiding a secret. Not because it was a secret to me, but because I really didn't know if I was going to miscarry or not. And how do you tell people that? Will I miscarry on Christmas Day? On New Year's Day? I'm living in fear. I'm terrified to use the bathroom because I don't want to see blood. I don't want to see a baby. The only way I survive is to not give up hope. I do everything I can to not lose the baby. I stay in bed. I don't want to risk hurting the baby in any way possible. I continue to take progesterone because I'm not going to lose this baby if the baby is okay. I had a doctor appointment with my OBGYN soon after this. He pretty much says the same things. He's sorry, but I'm gonna miscarry any day. He doesn't want to prescribe me any kind of medicine to induce a miscarriage because he doesn't feel it's necessary. And honestly, I couldn't take a medicine to induce a miscarriage because I feel like there's some hope baby will be okay. I wasn't going to give up hope. I want this baby with every fiber of my being. We go to see Christmas lights and I'm walking around looking at the Christmas lights, think to myself, this is probably the last moments I get to spend with my baby. New Year's comes and right when it does, it hits me like a brick. I wake up at about 3 a.m. New Year's Day, extremely sick, throwing up. I'm in pain. My muscles in my legs are hurting very bad. I finally break down and beg someone to please take me to the hospital because I don't feel good. I believe that there's an infection in my uterus because I still have not miscarried yet. when the doctors are telling me that I will at any moment. I don't know why I'm so sick. We go to the ER and I'm sitting there for several hours trying not to throw up in the floor. They finally bring me back to one of their small rooms. I tell them everything. I tell them I'm worried I have an infection in my uterus because I have not miscarried, even though the doctors keep telling me that I will any moment. But I also tell them that I'm not even sure that I'm gonna miscarry and baby could be okay. The doctor tells me that it's unlikely that I have an infection, but he wants me to get an ultrasound. They take my blood to do a blood pregnancy test to check my HCG levels, and they also do a urine pregnancy test. Both were positive. The blood pregnancy test results says my HCG levels was 60,000, which gives me a lot of hope. After hours of waiting, the dread, the pain, the agony, the suffering, I didn't know what the ultrasound would show. The doctor finally comes in and tells me the ultrasound tech at the hospital is off for the day. It's New Year's Day. It's a holiday. I'm really upset. I just want answers. But the doctor tells me, don't worry, we have an ultrasound machine back here at the ER. I'm going to give you an ultrasound myself. We wait another hour and he rolls in the ultrasound machine. It's not as advanced as the one they use in the hospital, but I'm just thankful that I'm able to get one at this point. He does the ultrasound. The good news is I don't have an infection in my uterus. The bad news is they can't even really see anything at all. He tells me the same things. My HCG levels are very high, but baby's not even visible to him, and I'm gonna have a miscarriage. At this point, I pretty much accept it. I'm going to miscarry. I go home with a diagnosis of the flu. I still feel horrible, and I feel horrible, nauseous, and faint for weeks. I had another ultrasound appointment at the hospital about a week later, and I pretty much have this appointment blocked out of my memory, but basically she told me the same thing she did before. I'm gonna miscarry. I make the decision at this moment when I know that there's just really no hope for the baby at this point. There's no doubt at this point that the baby is growing or developing. The baby doesn't have a heartbeat. I decide to stop taking progesterone because before then I had continued to take progesterone because I was not going to give up hope. This was a really hard decision for me because I felt like I was giving up, but I just pretty much was given confirmation that I was gonna miscarry regardless. It was a week later. My husband's father, my father-in-law, sadly passes away. My husband is greatly upset, but so strong through it all. We have his funeral January 15th, 2022. The very next day, it is snowing outside. I'm 12 weeks pregnant. We all go outside and let the kids play in the snow, building snowmans, throwing snowballs at each other. I flew my drone up in the sky, and as it landed and we were heading in, that's when my husband tells me, look down. When I look down, there is blood, lots of blood going down my leg, and it's showing through my pants. I don't physically feel bad at this point, and emotionally, I feel relieved that it's finally over. I had been pregnant for months, even after they had told me I was gonna miscarry. There was no more guessing, no more hoping. It's a fact, I'm miscarrying. I go to the bathroom, and that's when it really hit me how horrible it is. It wasn't just a little bit of blood and a little bit of tissue. I'm gonna put up a trigger warning. It's gruesome. I had a very large piece of tissue, and I don't know if it was the sight of the blood or the blood loss, but I'm nauseous and very faint, and I fall to the ground. I crawl to the bathtub, and my husband helps me get inside the bathtub. I don't know if I should really go into too much detail about this. Let's just say I had to push. I had to get down on all fours and push like you do when you're delivering a full-term baby. After that, I put a pad on, my clothes back on, and I laid on the couch. I think it's all over. I'm okay. I'm relieved. A little while later, maybe 10 minutes later, I feel something, for lack of better words, shoot out of me. I jump up and I go to the bathroom, and it's large pieces of tissue. I clean up, I change my pad, and I go lay back down on the couch again. A little while later, some more comes out. Some I have to push out, some just shoots out of me. This goes on for hours and hours. It wouldn't stop. Because I was bleeding so much, my husband wanted me to get into the bathtub just so I would bleed into the bathtub instead of everywhere else in the house. It seemed like buckets of blood just kept coming out of me. At this point, I can't even stand up anymore because I instantly go faint. I'm about to pass out, so I just hurry up and lay back down. The blood just won't stop coming out. I give up. Every last bit of energy leaves me. I'm out of trying. I can't even stand. I'm just accepting that I'm just gonna bleed until I don't bleed anymore. I can't get up and it won't stop. My husband gets me out of the bathtub, puts a pad on me and clothes on me, and lays me on the couch in his game room, which is right next to our bathroom. And I'm just laying there. Blood leaks out of my pad. It's coming out so much, but I can't make it stop. And I'm so faint and I'm so out of energy that all I can do is just lay there. I just remember being numb, just so numb. Thankfully, my dad is here watching my son and daughter. My husband calls 911. The ambulance arrives. They come in and check my vitals. They want me to stand up to check my vitals while I'm standing up. But after a few seconds, I immediately start feeling the rush in my head, and my sight starts going black, and I need to lay back down because I'm about to pass out. They advised me I need to go to the hospital. I agree. They put me on the stretcher. I don't even know how they maneuvered the stretcher through my house and out the door. I remember seeing my son and daughter and me telling them everything's okay. You don't have to worry, everything's okay. They parked the ambulance on the road, so they had to push the stretcher through the snow to the road. I don't even know how they did that, but once I was in the ambulance, as they were driving, it seemed like we were going backwards. I was really confused. I begged the guy to please not put an IV in me while we were going down the road, because my sister had told me before that when you are in an ambulance and they put an IV in, because of the bumping of driving, it hurts. And my vitals at that point were to the point where I needed an IV. But he's like, okay, I'll recheck. And I just was slowing my breathing down, and it knocked the vitals to where I didn't need to get an IV at that moment. Once I arrived at the hospital, they wheel me to an ER room, and they have to help me into the bed because I cannot hardly stand by myself or I will faint. There's blood everywhere. At this point, I have an extremely nice doctor at the ER. I just want to clarify really quickly that I say doctor right here, but I mean the nurse. I'm telling him I'm scared, like I don't want to get an IV, but he's so nice and he's like, it's not going to hurt at all. When I had an IV when I was going into labor with my son, it felt like a stick going in my arm. It didn't hurt as bad with my daughter, but it did hurt when I was giving birth to her as well. And he told me, you're not even going to feel it, trust me. And when he puts the IV in my arm, it didn't hurt at all. He was so nice. Then the doctor in the ER comes in and he wants to do a vaginal check to see if there's any tissue left from the pregnancy. I get the feeling that he doesn't do a lot of these checks very much because he had the speculum and he put the lube on it, but he sat it down for about 5 minutes and asked me questions before he actually used it. So by this point it was like dry, and when he was doing the exam, it felt like he was ripping my vagina. And I told him this. The nurse that was there, not the nurse that had given me the IV, but a different nurse, she told me pretty much just to get over it. Afterward, that nurse cleaned me up and the doctor said I was okay. They also drew my blood to do the blood count to make sure my blood count was not too low because I had severe blood loss. So the blood results had come back for my blood count and they said that my blood loss wasn't too bad. It was at, I believe, a 10. That it was still at a normal level. At this point, the doctor in the ER tells me I'm good to go, that he is going to let me go home. I'm sitting here thinking, but I can't even stand. I'm so faint. I tell him I'm bleeding really bad. I don't think I'm okay. He says, you're not really bleeding as much as you think. When he leaves, I tell the very nice nurse there, I don't think I'm okay. Can they please recheck me? So he says, yeah, sure. We'll recheck your blood. See if your blood count has changed any, and we'll have him do another vaginal check. So they do this. They draw my blood, send off my blood to get the results, and that doctor also does another check. At this point, I kind of honestly blurred out that, and I don't really remember anything about that. But here I am sitting in the ER bed. I'm thinking, I'm about to go home. It's all over. Next thing I know, the doctor and the nurse come into the ER room and they tell me, you're being admitted into the hospital. You need a blood transfusion. Your blood loss is getting down to dangerous levels. They checked it again and it was at a 7. And they say, 5 and below is deadly. Here, sign these papers so that we have permission to do this. I wanted to share the actual emergency department notes from the ER doctor. This is what he wrote about my diagnosis and the procedures that happened. It is called the MDM, number of diagnosis or management options. Anemia and miscarriage, diagnosis management comments. IV was established. She is given IV fluids. Labs were obtained. Initially, H&H was 11.5 over 33.8. She is given morphine for pain IV fluids and is feeling better. Her quantitative HCG is dropped significantly from earlier this month for like her symptoms are consistent with active miscarriage. Initially discussed case with doctor. She felt with a hemoglobin of 11 and no active bleeding seen on exam, she could potentially discharge for a follow-up. Patient still stated that she is having significant bleeding in the ER. Because of this, he is observed for a few hours. It says he, but it should say she. And her hemoglobin was rechecked. Repeat speculum exam showed persistent clots within the vaginal canal. She does have some persistent oozing from the cervix on speculum exam. She is feeling somewhat better. However, repeat H&H has decreased to 7.2 over 21.4. Secondary to dramatic decrease in hemoglobin. I discussed his case, again, it should say her case, with doctor, and I'm blurring out the doctor's name. She agreed with a blood transfusion and admission to the hospital for repeat H&H and potential DNC. I discussed this with the patient and family in detail. They expressed an understanding. Patient was in agreement with admission and with the blood transfusion. She is made NPO and no questions at the time of admission. The nice nurse in the ER, he gives me Ativan and my IV. He tells the hospital, look, let her husband go with her so she doesn't have to do this alone. And so my husband walked with us. They take the bed in the ER and they wheel it with me in it to the labor and delivery floor of the hospital. Here I am in the floor that you go to give birth, but I'm here because I'm miscarrying. The OBGYN at the hospital, she is from the office that I go to, but she's not the one I normally see. She gives me an ultrasound and says that there's still some of the pregnancy left over inside of me that she needs to remove. After this, I can have a blood transfusion. She puts my legs in the stirrups. She uses these long surgical instruments. I honestly forget what they're called. And she pulls out the last bit of the tissue that was inside of me. This was not a fun experience, but because I had Ativan, it helped. Once she says everything's out, she gives me another ultrasound and says, you're good now, you can get a blood transfusion. Shortly after this, they hook me up and the blood goes through to my veins. They give me multiple bags of blood. After each bag of blood, they check my blood levels. Finally, after the last bag of blood, they check my blood levels and say my blood levels have went up to a safe range now and I can be discharged and go home. I get up to go use the bathroom for the first time after getting a blood transfusion. I'm still faint, but not as much as I was before the blood transfusion. So I'm stumbling around trying to get to the bathroom, and there are two nurses in the room with me, but they were talking with each other, and as I'm stumbling, they're laughing at me. I don't really think it's funny. After this, I gather my stuff and me and my husband are ready to leave the hospital. One of the nurses at the labor and delivery floor brings me a wheelchair. I sit down in it to leave the hospital. They're gonna take me down to our car. The nurse says to me, having a miscarriage is a sign you need to stop having kids. I don't feel good at this point, so I just ignore her. She also gave me a bracelet that says forever in my heart and a purple butterfly. She also informs me that they sent off what the doctor was able to get out of me to do tests on. I'm wheeled out to the car and my husband and me leave the hospital. I'm so thankful that my husband was with me by my side through the whole ordeal. We go to Applebee's before we go home, but I'm only able to eat a couple bites. I'm still pretty sick to my stomach. The recovery was long, but each day that passes I feel better. Emotionally though, I was struggling. It's really hard to recover from a miscarriage and navigate how horrible it went. I kept thinking to myself, if my husband hadn't forced me to go to the hospital, and if we hadn't insisted on me being rechecked after the doctor said he wanted to send me home, I probably would have died in the night. I wouldn't have stopped bleeding because there was tissue left inside of me from the miscarriage. It was an incomplete miscarriage. If the OBGYN hadn't have removed the last little bit, I wouldn't have stopped bleeding. I would have continued to bleed horribly. I kept thinking how my son and daughter's life would have been if I would have died. I'm so thankful for my family for being here for me. I'm thankful for the angels who donated their blood so that I could use it. I'm thankful to the doctors and nurses for helping me. And I'm so thankful to God for putting all the pieces together. It just wasn't my time. I'm dealing with all these emotions of I would have died, but my baby did. The miscarriage I had is classified as a missed miscarriage. I was supposed to have miscarried weeks before I did, maybe even sooner. I believe that the reason I stayed pregnant for so long is because I continued to take progesterone. I think that's what I did wrong in this. I didn't want to give up hope, and I don't want to tell anyone to not take progesterone because it can really help you keep your pregnancy. In fact, I urge you, if you have miscarriages, to ask your doctor about progesterone. I wanted my baby. I would do anything in the world to keep my baby, even if that meant I nearly lost my life in the process. I, on purpose, left out a portion of what happened during my pregnancy to wait till the very end of this video because this is going to be a little controversial. And this has to do with x-rays and radiation. A few days before I found out I was pregnant and had the positive pregnancy test, my daughter had hurt her finger. She got it smashed in a door. It was very concerning how smashed her finger was. I thought there was a chance she was going to lose her finger. I didn't know if her finger was broke or damaged. In panic, we rushed our daughter to the hospital. The doctor at the ER wanted her to get an x-ray on her hand. I was so concerned about my daughter's hand that I didn't really think about the radiation, and to be honest, I wasn't educated enough in it. My daughter is a mama's girl and she wanted me to hold her while they gave her the x-ray. So she sat in my lap, she stretched her little hand out in front of her, and they had the x-ray machine pointed towards her hand. But the x-ray machine was also pointed towards my stomach. They had to give her multiple x-rays of her hand to get better imaging. They wanted to check to see if her finger was broke. They didn't put anything on us to protect us from the radiation, and they quickly gave her an x-ray. They didn't ask if I was pregnant or thought I was pregnant, and like I said, I didn't know that it was a risk factor. Immediately after they left the room and the x-rays were finished, I was concerned. I asked my husband, what if I'm pregnant? Do you think that hurt the baby? But to be honest, I did not think I was pregnant at this point because I didn't really have any pregnancy symptoms. I had no clue that I was 4 weeks pregnant. It was only a few days later that I took a pregnancy test and it was positive. I had confirmed that I was pregnant. I had no clue. The next day after I found out I was pregnant, remember, I did get a faint positive pregnancy test. It was fainter than the day before. This concerned me, and immediately I thought about the x-ray, whether that caused a miscarriage. I did a lot of research on this when I was pregnant. I was concerned, but there really was nothing I could do. It was already over with and done, so all I could do was move forward. I never imagined that the month that my daughter needed x-rays, that would be the month that I found out I'm pregnant after 2 years of trying to conceive. I can't help but wonder if the x-ray that my daughter had that was pointed directly towards my stomach had anything to do with this. Throughout my entire concerning pregnancy, this thought greatly bothered me. I researched the likelihood that an x-ray could cause damage to a pregnancy and an unborn baby. This is what I found. So an x-ray is also known as x-radiation. An x-ray is a penetrating form of high energy electromagnetic radiation. What is radiation? Here's the definition. I'm just going to read it to y'all. Radiation is energy that moves from one place to another in a form that can be described as waves or particles. X-rays are a form of energy, like light and radio waves. Unlike light waves, X-rays have enough energy to pass through your body. As the radiation moves through your body, it passes through bones, tissue, and organs differently. This allows a radiologist to create images of them. The radiologist is a specifically trained doctor who can examine these images on a computer display. X-rays allow the radiologist to see the structures in your body in very fine detail. Radiation is also associated with cancer. The cancer risk associated with radiation exposure is documented in cases of atomic bomb survivors. The risk for medical use is controversial and usually played down allegedly. Radiation has the potential of causing cancer, but this is usually associated with higher levels of radiation. The level of radiation exposure from X-rays is low. The effects from low-level radiation exposure, though, however, is not really known. The risk of exposure should balance the medical benefits. Children are 10 times more sensitive to radiation than adults. CT scans are very similar to X-rays. In fact, it's basically getting X-rays around your entire body. They also offer a lot higher detail in imaging. With this higher level of detail that you receive from a CT scan, you also receive a lot higher level of radiation versus with X-rays. In my research, I found these statistics online. 3 to 4 million children receive CT scans, and about 1,500 of them will develop cancer 2 decades later. Children should absolutely not be given an adult dose of radiation. During pregnancy, your baby is especially at risk in the first 2 weeks. Exposure to high doses of radiation in the first 2 weeks can result in a miscarriage. I was in my first 2 weeks of pregnancy when I was exposed to that radiation. I was 4 weeks pregnant. From what I understand, it's not recommended to get an x-ray when you're pregnant. Exposure to high radiation 2 to 8 weeks after conception might increase the risk of fetal growth restrictions and birth defects. Exposure between weeks 8 and 16 might increase the risk of intellectual and learning disabilities. Definitely, if you are pregnant or you think you might be pregnant, you need to let your doctor know before you get an x-ray or CT scan. Depending on the circumstance, you can postpone it. In addition, the guidelines literally say if you are pregnant or you think you might be pregnant, do not hold your child if your child needs an x-ray. Keeping all this in mind, the typical dose of a single radiation exposure associated with diagnostic x-ray is much lower than the high dose associated with these complications. However, I'm not one to take risks. If I know these complications are associated with x-rays and radiation, then this is what I'm going to do moving forward. I will not absolutely under any circumstance voluntarily get an x-ray or CT scan unless it is absolutely necessary. I don't want my kids to get them either unless, again, it is necessary. In fact, we had dentist appointments a month ago for my husband, me, and my son and my daughter. For the adults, they wanted us to get x-rays. I let them know I thought I could be pregnant. I wasn't sure. I told them no, I'm not going to get an x-ray, and they said I couldn't get my teeth cleaned, but it just wasn't worth the risk to me. We are still trying to conceive, and I will not get an x-ray just to get my teeth cleaned. That can wait until we are for sure done having kids. I understand that in certain circumstances, x-rays and CT scans are absolutely necessary. However, I'm strictly talking about my story and what I did wrong. I wish now that my daughter had never even received an x-ray. She did end up having a broke finger, but the treatment for her finger would have been exactly the same whether she received an x-ray or not. Her finger would have been wrapped regardless. The x-ray was just simply not necessary. It was just an added cushion to thoroughly examine her. My biggest regret in my pregnancy was letting my daughter get an x-ray, not only putting her at risk, but also my unborn baby. Do I think the x-ray had something to do with my miscarriage? I certainly don't think it helped in my pregnancy. This is my warning to pregnant moms and TTC moms. We need to be careful with what we expose our bodies to. It's important for us to take care of ourselves. And also we need to take care of our kids and not expose them unless it's necessary. I did ask my OBGYN if he thought the x-ray could have caused the miscarriage, and he said no. I just know from now on, I will do my very best to not get exposed to radiation unnecessarily. I don't know if I failed. In that moment, I was just doing the best that I could. Thank you so much for listening to my story. My heart reaches out to anyone else who's ever had a miscarriage or loss. My husband and I are still trying to conceive our next baby, and I will continue to share our journey here on this YouTube channel. Also on my TikTok, Facebook, and Instagram account. I will leave the links down below. I love y'all so very much, each of you. You are all so special, and I'll see you in our next video.